Cholesterol is obviously important. I don't care about stuff I can't fix. So I can't fix the HDL. It's hard to fix the triglycerides without getting atrial fibrillation. And lipoprotein A has no medicine right now. So I just concentrate on getting the LDL as low as I can. You can't be too rich, you can't be too skinny, you can't have too low an LDL. The lower, the better. Lipoprotein A is a genetic marker. You do it once in your lifetime. It does increase your heart risk, but we don't have any medicines. We may in a year or two. But then the big question is going to be, if the medicine works to lower the lipoprotein A, does it prevent heart attack or death? I'm using a lot of a combination of a medium dose statin with ezetimibe, a very low side effect profile and very effective in preventing heart attack and death. Be skinny, 40% of Americans are obesity. That's a very scary number. If you have skinny friends, you'll tend to have a better weight. Obesity affects 1 billion people across the world. More obesity, the worse your mental health. Loneliness, obesity, weight gain in young middle-aged adults linked to poor heart health as they get older. Cognition and weight. Overweight teens and young adults get more heart disease as they grow older. 1 in 5 children has excess weight. Diabetes is an epidemic. Intermittent fasting, I don't know, I think that changes every 6 months. Dr. Assis, where do we stand now with intermittent fasting?
I think it's equivocal. So both sides, I think people with insulin resistance and prediabetes and diabetes, the evidence is stronger for intermittent fasting.
I intermittent fast, I don't eat lunch. So I don't eat between 7 in the morning and 9 at night. The reason it was my first day at Duke, and I was on the ward and people were vomiting and dying and GI bleeding, and it was 12 o'clock and the guy said, let's go have lunch. And I said, I don't think I can even practice at the same time. So obesity meets its match. The Ozempic and all the other drugs seem to reduce the risk of cancer. Eric Topol, again, 54% reduction in adverse events, mirrors how the body's incretin system evolved over 500 million years to regulate metabolism and cardiovascular function. Nature's elegant solution is now repurposed for modern medicine. Those Ozempic boost fertility. Ozempic for arthritis, half of people, the arthritis got much better. Ozempic for sleep apnea, half the people got off the machine. Ozempic for heart patients, and when I say Ozempic, I mean all the drugs. Decreased death, heart attack, and stroke. Decrease in 11 obesity-related cancers. Reducing body-wide inflammation. So inflammation is really the dirty word now in medicine. And the reason these drugs work is weight loss, but much more important than weight loss is the fact that they're anti-inflammatory medications. People taking these drugs had a 31% decreased risk of dementia. Now, this is going backwards. So there are studies going on going forwards now. So I can't promise you that these drugs prevent dementia and Parkinson's, but it wouldn't surprise me if they do. Less blood cancers, less dementia.